Over to you, sir. I'm just sharing my screen.
Thank you and a warm good evening, sir. And ma'am, this is an opportunity that we uh, have this event every January and August, and this started with the very first batch, and it is every year, every 6 months we try to get contact with the alumni of DM Cardiology from PGI, and we just wish to see how the journey after PGI and where they have reached and how. So most of us have contributed greatly in field of cardiology and otherwise also. So this is 1983 batch, and we start with Dr. Suman Sharma Rao. There's a brief video for her. So over to you, ma'am. Whatever you wish.
Yeah, I feel actually honored to be here and to be remembered by the young cardiologist. Actually, I had even forgotten that I was in the 1983 batch. Once you reminded me, I had to check the certificate whether it was 83, which batch. I had actually all forgotten. It's a long time back. As you know, I worked as professor and had cardiology here, then as a director of medical education. In between, I was to United States, worked in as WHO fellow in under Dr. Valentine Fuster, where I did 3D echocardiography and presented some papers also in New Orleans in American Heart Association. Worked in Mayo Clinic for about a month, and WHO fellowship was about 1 to 2 years. And then in between, I was with the government of Saudi Arabia, worked as consultant cardiologist, and later on. Then I set up a heart center with a non-invasive cardiology, and and during that time I was the first DM cardiologist in Himachal Pradesh, as you know. And when I joined in IGMC, because I was from this place only, then I had to start the cardiology department from a pinpoint. There was no cardiology department. I had to work in internal medicine as a unit in cardiology. Later on, the department started. We purchased an echo machine, and just I had been doing 3D echo. Then later on, it had to be from a scratch only. We had echo non-invasive, and like in 90s, then the cardiac cath lab started, and later on, so under then so many other cardiologists joined. Now we have a full-fledged department, and I've established here a heart center at the Reach in Shimla only, with a non-invasive. That is all I can say. But I really feel honored and seeing young cardiologists doing so much of interventions and just keep us updated and all. That is all I want to say.
Basic idea of ma'am this meeting particularly is that you recall what has happened during trainings, few anecdotes, few funny anecdotes, few something serious. And because 1983, your batch was most difficult to trace.
Yeah, I just wanted to tell you, you didn't invite Mishra also was with Rakesh Agrawal, Sarat Chandra Mishra. When I was a cardiologist working in Middle East, I had gone to Middle East for 3 years, I told you. Na? Sharat Mishra was with me. He was a batch just next to ours, like in Rakesh Aggarwal and all. After that, he had gone to Kuwait border in Middle East only. Then I left contact with him. He was with us.
So,
And
ma'am,
nothing particular during my DM stay. Just we had to work and all. There we had, at that time we were doing cardiac caths only, pacemakers. There was no angiography and anything that time. We had only AMO technology. When I passed, then the 2D machine had come. Then I had to come for training again here in PGI to learn 2D echoes. That is all, nothing much during that time. Dr. Y was the head of the department. Then Dr. Sapru, I know, was there, who is now here working in Chandigarh only. Otherwise, nothing special I can say.
Dr. Subba Rao is also here. Ankala Subba Rao
hello.
is also
Can you
here.
hear me?
Sudhaya Kumar is also here.
Hello, Dr. Dr. Smita Srivastava. Can
Smit
you hear
Shiva.
me? Smith. Okay.
Smith.
Do you hear me? Okay.
Yeah, we can hear.
And Dr. Suman, you have
Yeah,
forgotten
yeah.
me or what? Have you
Huh?
forgotten me? I was in the same Mishra batch. I was my classmate of Mishra, Ankala Subbarao, A.B. Subbarao.
Yeah, I know. Definitely, I do know.
You
I
were
recognize
classmate
you
of
like
Madan Lal, no? Madan Lal,
Madan
Girija,
Lal and Girija and all. They were senior
and
to us, you know.
Suresh. Actually, you
Even
were
Claire Tirlochan, T.S. Claire, who is working
T.S.
in
Clare.
forces now. Claire,
Yeah,
yeah.
Suresh. There was a 5-member batch.
Suresh, I used to meet during the conferences and all. You know,
Yeah.
I was given DP Basu Award in 1987,
Yeah.
complimentary award. Yeah,
I
I had
remember
arranged a
you very much.
conference also, a national update, where all the
Oh,
cardiologists from India had come. You know, that was
okay.
the first update, and even from United States, I had invited somebody from Mayo
Okay.
Clinic.
That's
Yeah,
wonderful.
I
Yeah.
know, I recognize you. Yeah,
I think it's
looking the same. Yeah.
no. I lost all my hair.
No, losing hair is no problem. But otherwise, you know, face remains the same.
Oh, thank you so much.
Actually,
I was
yeah,
the only
yeah.
one from Andhra Pradesh in my batch, I think. After Somaraju,
Uh-huh.
not many people got them, and they were preferring to go to Alumni Institute rather than PGI. But somehow I got into PGI in 1982, if you remember. I was
Yeah,
just 1 year, 2 years junior. You belong to
yeah.
Rajesh Agrawal's batch, huh?
Rajesh Agrawal's batch,
Oh,
yeah.
I thought you belonged to Madan Lal's batch.
No,
Madan
no.
Lal,
Actually, you know
Girija.
what had happened was I had these people from IGMC Shimla had sent me for training in cardiology. So
Oh,
I had come,
well,
yeah,
service
just
kid.
to be, yeah, just they had CCU training and all my cardiac emergencies and all. During that time, there was an interview for DM cardiology.
Okay.
So I worked for 6 months. Then I competed for that. Then
Oh,
yeah.
okay.
Then I
So
was
somehow
selected.
I
Yeah.
got confused. I mean, I was thinking you are for a part of that 5-member batch. Madan
No,
Lal, Claire,
because yeah,
Suresh Kumar, and
when I
Girish.
joined, they were with me. I
Okay.
was doing the training program over there.
Okay.
Yeah, then Dr. Y, because I was not much interested, but Dr. Y said, you give an exam and yeah, appear for the DM entrance test.
You're a
Then I was
favorite of
selected.
Professor Wahi, I know that.
Yeah. That is the
Very
reason,
nice.
yeah.
Very
And
nice.
Girija was the only female, so she was with me.
Yeah. Yeah, I know, I
Girija,
remember we
Suresh, yeah.
exchanged duties.
Madan Lal was from, Mohan Lal was from
Jammu.
Jammu. So,
Mohanlal,
yeah,
na? Okay.
Claire
He's
from
from
Ludhiana, T.S. Claire,
Acha,
yeah.
acha.
So
Yeah. Suresh is from Kottayam. And I see
Suresh,
Sudhaya
yeah.
Kumar appeared and disappeared. He was an immediate senior. I think he was part
Yeah.
of your
Actually,
batch.
my daughter, she is working as
Oh,
assistant professor in cardiology in RML Hospital,
really? That's
New
great.
Delhi. Yeah, she's also a
Like
DM
mother, like
cardiologist.
daughter, huh?
Her husband, you know, he's in AIMS at the he's a MCH and gastro surgeon. Why I'm
Oh,
telling you is because he was working in a Lakeshore hospital in Kochi.
oh,
He
he
was
said,
doing liver
okay.
transplants and all. So after that, he was selected in AIMS. So that is
He
the
was
reason
a,
he had to shift to RML hospital. Yeah.
but he
Doctor,
he's from North India.
He's from Himachal only.
Oh, but he went all the way to Kochi. Okay.
Kochi, but liver transplants and all, they were being done at Lakeshore.
Amritanandayam.
Yeah.
Mata Amritanandayam.
Yeah, he had done about 30, 40 liver transplants and he was
Okay.
gastro surgeon. Actually, MCH he did in Lucknow, Sanjay
Oh,
Gandhi Institute. Yeah.
that's great.
Then after that, he was in AIMS. So my daughter, she was after doing DM,
So
she worked
you were
in
not married at that time. I was married. I had a daughter also at that time.
I was not.
I think
Yeah.
you were.
Yeah, I'm also Rao, but my husband is from Himachal only, like
Oh,
in
we had
Haryana
come to
and all.
Shimla once, but I forgot.
Yeah, yeah,
Okay, it's very nice to hear. Yeah.
same here.
I remember
Like,
one episode, if you don't mind, if I tell
yeah,
you
yeah.
about you presenting one data when Bidwai in front of, we used to have that pre-angio check meetings, you know.
Yeah,
So
yeah.
one of those meetings, you were telling what I think we used to have some paper presentation or something, some presentation you were giving. So during that time, I remember you were tabulating a lot of statistics from one paper regarding data from regarding one probably heart failure. I don't know. I don't remember exactly the topic, but I remember what happened on that day. Just for
Yeah, yeah,
remembering the old days.
yeah, yeah.
That time you had composed a lot of then Professor Bidwai suddenly stood up and said, all of you tell me why you joined BIPC, why didn't you take MPC? Then we were all, I was saying I wanted to become a doctor, and somebody was saying, so everybody was saying his own thing. Then Professor Bidwai, he said, I joined BIPC because I wanted to avoid mathematics. But
Yeah,
now I come and find out that everything you are saying is mathematics again. I'm not able
yeah,
to
yeah,
make out what it is. So I remember that event
yeah.
during our interaction. Of course, you're a teacher too. You were a teacher. I mean,
Dr.
we
Smit, am
used
I
to
audible?
teach each other.
Yeah.
Thank
Yes, sir,
you.
you have to switch your video.
My,
Switch on your video.
am I audible or not?
You are audible, but you are not visible.
Or maybe I'm better off visible and invisible.
I think you have to
No,
start
no.
from there because my video is on.
I see. I don't know where I have to press here.
Some problem.
Here the stop video is there and video settings. I'm going to the video settings. Okay.
You can select your proper camera, or might be
There
the
is, there is
you need to turn on the
yeah,
shutter.
video. Okay. So advanced always
Yeah,
display
I
participant
was
name
hearing
on
to
the videos.
Suman what she was
National low
saying.
light.
So nice
Touch
to
up my
see Suman.
appearance. Yeah, yeah. Maybe I should touch up my appearance also. Otherwise, you
Yeah,
feel
I can
I'm a
see.
ghost or something.
I can see
That
now
is
Sudhaya
Sudhaya.
Kumar.
Sudhaya Kumar. How are you?
Yeah.
Long time no see.
My daughter is in all praise for Sudhaya Kumar.
Yeah, he is.
Yeah, she had gone to Chennai to attend some, I don't know, he had some, I don't know, updates or something like that. I said you should have introduced yourself to Dr. Sudhaya. Yeah.
So we play his video now, if you allow.
Am I here?
Because most of the
I don't
members
know.
of this batch are either not doing well. So there is some concern with Dr. KK Kapoor. He has some problem with the back.
What happened? Hey, what happened?
I just had talked him on phone, sir.
Oh, what happened? Right?
Yeah.
Okay.
Link बड़ा भेज यार. No, complete just send me the link again.
Great. Am I visible now?
So Dr. Kapoor, he said he had some problem with the back and he has not been attending his hospital for about a year.
Oh, really? So Kapoor was my junior, but anyway, he was an echocardiographer par excellence, no?
Yeah.
Maybe he was doing too many echoes or what?
Yeah.
And others are traveling. So I could talk to Dr. Amar Singhal's relation, but he's again out of country. Dr. Rajesh Agrawal is out of country.
Very nice.
And I could not get anything about Dr. Rakesh Agrawal.
Rakesh, oh, he's in
He's in
Ludhiana.
Ludhiana.
He's in CMC in Ludhiana. He used to be. I don't know where he is now. I met him around the conferences 20 years ago, I think. More than that.
So over to Dr. Sudhaya Kumar.
Yeah,
That was the briefest video that I had seen till now in for PGI Alumni.
I see. I'm not prepared one, so I'll prepare one and send. Okay. Dr. Sudhaya Kumar is
Okay, fine.
walking cardiologist.
Great good evening.
Walking encyclopedia of cardiology. Walking brown world.
Okay, great good evening. Nice to see you all. Thanks, Dr. Smit, for giving us the opportunity to meet again. Great nostalgia of 82, 83, when I had the opportunity to work under Professor Wahi, Bidwai, Khatri Saab, Sapru Saab, and Anand Saab, along with my two close friends, Suman Sharma and Rajesh Agrawal from Patna. And this next time, I think I had A.B. Subrao from Rajamundry. Am I right?
I was originally from Tirupati. Now I'm settled in Rajamundry. I have my own practice here.
I remember this Rajamundry. I don't know. After that, we might have contacted. We had a great time at that time. And Subrao is junior to us.
Myself, 6 months.
And Rajesh. Next batch. Because it was Subrao alone at that time.
Oh, and Mishra was there. Mishra and myself were, we were both classmates.
Okay, fine. And the senior batch was Dr. Suresh, Dr. Girija, and Dr. Claire, I think.
Claire,
Jagan Mohan, all 6 months.
Jagan Mohan is senior. Still senior.
Chitra, he was in Chitra,
He did DM later. He did DM later.
No. Jagan Mohan is 1 year senior to us. Jagan Mohan is 1 year senior to us. Yeah, no doubt.
Yeah.
Bahulayan, all those from that
Bahulayan,
they are sizable number from Kerala. No doubt. There is Bahulayan was quite senior. Then is Jagan Mohan. Then Suresh, Girija, Mohanlal. I think Dr. Claire, a close friend of mine, because I still remember our interaction both at bedside, OPDs, echocardiogram, night duties, cath lab, all those things. We had an extremely nice time, and we had really enjoyed that time. But second, that time I still remember I was very poor in Hindi.
Raman, there was one Raman also.
Raman was quite senior. Raman was when we joined, he left. That was the time. Okay. Then Dr. Claire, I think at that time, Professor Wahi, very shrewd person, you know that. That thing and writes everything. Very time. That always he with that pencil and that lead pad, he puts on 8 o'clock Dr. Suman Sharma to meet, 8:10 Sudhaya Kumar to meet, like that. And 1:30 we have to be there. Very meticulous. I really enjoyed that. And the thing was, he used to pick up the problems or the pros and cons of each candidate. What Suman Sharma knows where she is weak similarly. And she knew he knew that I was from Kerala, I don't know Hindi, I can manage or academic, okay. Then I had the help from Dr. Claire. So Claire used to help me a lot in administration, because the problem at that time was to create bets during the admission days of each.
I remember.
That was a problem. So
especially in Friday OPD.
And, I tell you very clearly, Dr. Claire does the whole thing for me. So ward work along with Claire, it's extremely difficult to have the ward work. Angiogram, everything is easy because don't be grilled during that post-cath. And we had a tough time, but we learned a lot. Especially Dr. Sapru wants the references. You can't quote that in brown ball. You have to quote the reference. OP was really enjoying, because one day Professor Wahi will put 20 cases to Suman and others are very free. The other day it will be to me. And I still remember, he gives 20 cases, we have to do the workup, he has to present, he puts a lot of things. And if I get, yes, I agree, then I will give coffee to everybody. So that was a very unusual circumstances when he gives a, really remember that. Dr. Claire manages the bets. Okay. So we had a very nice time. Very nice time during our stay with Dr. Suman, Dr. Aggarwal, and then Dr. Subbarao with his pickles from Andhra. Still I remember. He was with his family. Andhra pickles he used to bring. So now you realize, among the discussions which we had, who enjoyed the life in PGI most? The
I think it was me.
It was me, no doubt it was me. Obviously from the discussion, I can recollect the whole thing with
Yeah.
starting from the entrance exam, the spotter, the viva, all those things I still remember. Waiting for the admission, had some problems in my admission at that time. I got the admission. Then my seniors helped me a lot. Girija, Suresh, and Mohanlal.
Yeah.
Mohanlal, a very friendly person. Suresh, high vocabulary, very, very strong
Yeah.
person. He's in a great position now. He is a
No, I
top
met him. He
pediatric.
was in Middle East also for a time. I
He
had
was in
when
not
I had gone to
Yeah, he's
Kochi
a top
conference. He
person in
met me.
pediatric cardiology. He's an international reputation. So
Oh.
that's all. I joined Medical Education Service of Kerala in 1981. 82, 83, I did my DM from the prestigious institute, came back, joined service again. Progressively, I became the assistant professor, associate professor, HOD. Then I became the principal of the college, and then the director of medical education, retired. Then I worked in Amrita for about 7 years. Now I am very much very
Sometimes back you worked in, you were in Chennai. My daughter had attended and
Chennai,
she
it's
met
not
also
that.
you.
Now I am
Yeah.
interested in teaching, in postgraduate
Yeah,
teaching.
yeah. She
At
said
Vijaya
academics
Madras
and
Medical
all.
Mission,
She's
and
Shivani
they have
Rao.
a
She met you
postgraduate
and gave
teaching
my
program at
reference.
that time before COVID. There's a
Yeah,
fantastic
yeah.
program in Chennai, 2 or 3 centers,
She was
Hyderabad.
on all praise for you. Yeah.
No, I'm interested in teaching. That still I continue teaching.
Yeah, yeah.
Nice to see you all. A great pleasure.
She said
Real
very strict
nostalgia.
person, very
That is
strict. Dr.
A.V.
Sudhir, very
Subbarao.
strict,
Yeah,
to
yeah.
the rules.
I could not recognize you.
You could recognize me.
Yeah,
You
because
have
of
not
that.
changed, but we have all changed.
I know all of us have changed, but the problem is with your the
Hair
hair
gone.
loss.
All hair gone.
That's fine.
So why you are telling
I
about hair
remember
loss?
you
We
as
are
A.V.
the same.
Subbarao.
Face
Yeah,
is
Not
exactly
as
the
Sudhaya
same. You
Subbarao.
look
I remember
same.
still as A.V.
Hardly
Subbarao.
any change.
Yeah, yeah.
Then after that, we used to interact when you were
Yeah.
in Rajahmundry, by having your own clinic or something like that.
Yeah, yeah.
Anyway,
And
thank you,
also-
Professor Smith, for giving me the opportunity to see all my friends, colleagues, and my colleague Professor Smith also to talk with you. Great pleasure. Thank you so much.
Sir.
That
Dr.
is
Clare
okay.
is here, sir, though
Yeah.
his video is not on, but he's very impatient to be here.
Yeah, great.
Am I audible?
Yeah, you are
Yes,
audible, sir.
audible.
So I'm sorry there is some problem that I am not able to put my video on, but anyway, it's a great pleasure to meet you, all of you, and particularly to meet Sudhir. Sudhir Kumar was, he's right, actually, he was 6 months junior to us. You know, my batch was Suresh, Girija, Divakar
Mohanlal.
Jain, and Mohanlal and myself. we were a big group, and so they always, you will come with some new information, he will teach me, you know, though I was senior to him. There's a great time we had together.
Yeah, Dr. Clare. Remember me, Dr. Subbarao.
Yeah, I do remember, but
Yeah, yeah. Thank you so
we
much.
lost
You helped
contact
me a
for
lot.
many years.
Yeah, yeah, yeah. We
Uh,
kept meeting in some of the conferences, of course.
Right.
When you had done your MRCP also after
Yeah.
your DM. Yeah, then you were remarking that Dr. What's his name? Dr. Rajesh Agrawal, he also had DM and MRCP from Hyderabad, but he was not having MD. That's what you said. I remember.
No, I was MD and DM from PGI Chandigarh and then MRC from UK. So on paper I'm qualified, but practically I may not be.
There you are. No, but I can never forget your help when you helped me with my mother had cancer of the breast. You know, you helped me out. I don't think you remember also.
No, I really don't remember.
You don't remember. Yeah,
Yeah,
you don't,
yeah.
you've done so many great things, but you don't remember. And your wife is a legend. I know.
Dr. Clare, you haven't recognized me. I'm Dr. Suman.
I have
from
already,
Shimla.
as Suman, I have recognized and I told that I can see Suman speaking. Suman, मैं कैसे भूल सकता हूँ आपको यार हाथ होगी.
Now my daughter is in all praise for you also.
Yeah,
She keeps on meeting you probably.
she's a wonderful girl. Actually, to be honest with you, I want her to join my team.
Yeah, she's assistant professor in RML Hospital Cardiology.
उसको बोलो कि RM में काम करने का कोई फायदा नहीं है.
You tell her you are the best person to guide her.
Well, in his usual original form. Very amusing. Okay. His comments at that time also really enjoyed. Though I could not follow
He's
it, but
very hardworking. He has made his name.
not that he is a quite entertaining person. That's the number one.
Entertaining, yeah. And very
That is the
good.
most
down to
by
earth
entertaining
person.
person.
Yeah, definitely.
There is no
And very
question of being
helping.
junior to him, and there
Yeah.
is no difference. Many times
No
you find that the seniors look the juniors in a different angle. Claire
Yeah.
did not, Claire was really entertaining. I
Dr.
really
Claire,
enjoyed. He
beyond.
helped me a lot in administration.
A very
Reading
nice person,
Hindi,
down to
my
earth
Hindi
person.
funny Hindi words. He used to tell me that you should be careful. That may be very awkward also, my Hindi, like the fool jata hai, all those things. Khulna hai, gilna hai, all those things. I still remember I had very funny time with the patients also. Saas phulta hai, khilna hai, all those things. Okay, many mistakes I made. Claire said, okay, we are enjoying. He said that. He used to help me in administration. Because at that time, our nephrology chief, Chuk, Professor Chuk, is a strict person. Vahisab is also very strict. Now, what happens is cardiology patients are from the emergency will be admitted to all the units. Okay. No unit chief had the guts to discuss with the Professor Wahi and transfer the patient back to our side. Okay. But this did not work with Professor Chuk. So one day I saw him coming with his residents, everybody, and pulling this, asked the patient to sit in the tool, and he pulled back the coat to his ward. So at that time, the funny thing was, patient may be shifted to cardiology with the bed. That was the Professor Wahi's instruction. So from the nephrology, it was transferred. And the night we transferred. And the next day, he came with his colleagues and took the bed back to his ward.
Patient napped.
Patient asked him to sit in the stool. Okay. And he took the bed again. So these things I can't remember. Very funny, enjoyable. My son did my DM in endocrinology. Just now he completed. So I was to Chandigarh last month, and big change. At that time, that single grade building, Kairon block, then the canteen, then the doctor's block, and a big garden, lawn, everything where the Sardarjis used to take that sun bath or whatever it is in the morning hours. Then the consultants coming in bicycle, really great. Real nostalgia. Whenever I talk, it's a great thing. Now I went, it's full of buildings. So
Sudhaya Kumar, you came to Chandigarh, you came to Delhi without informing. Next time you do that, I'll get you arrested and put you in jail.
Now
You're capable of doing that also.
He has completed his DM endocrinology and joined Amrita Institute as the assistant professor in endocrinology last month.
I see.
Oh, very good, very good.
Very nice.
Yeah.
That's very nice. Dr. Sudhaya Kumar, do you remember? You never used to wear sweaters. Even during winter. I don't know how you
No, none of the Keralites used to wear. Obviously, Dr. Sapru from Kashmir, he used to put on, we used to put on sweaters. But usually people from South and doctors from South never used to put on sweaters and all.
Really? I'm not exactly from South also. Of course.
No,
I'm from South, but we used to wear, we could not and tolerate those winters.
So, friends, I need to go. So I want to thank Smit and Suman as well as Sudhay and Subarao. All of a great pleasure. And hopefully I join next meeting again.
Really enjoyed your voice, Claire.
Thank you.
And Sudhai, I also enjoyed Sudhai and Dr. Suman.
Bye.
Yeah.
Nice to be.
We'll again meet, I think.
Sure.
So, sir, we'll play the videos, though other members are not there, but there is a small video compilation. So I'll request the second to play them one at a time, not one at a time, all at once. And then we can enjoy our discussion.
Rajesh is from Patna. Is Rajesh Agrawal.
Basically, everything we have not contacted him, so we have downloaded it from whatever we could get from Google.
Good. Okay. Yeah. Can get everything from that. Okay, Dr. Rajesh was my immediate senior. He helped me out in a lot of problems. When we had one mortality meeting, Yeah. And nice to see the Rajesh Agrawal's video because he was my immediate neighbor in Caron Block. We used to stay in 413, they used to stay in 414. Hello.
Rajesh joined after a few months. There was some problem with his this thing, and he joined. And very pakka gentleman.
Yeah.
Had a very nice
Very good.
interaction.
And his
And
wife
he used
also,
to-
Meenakshi, I think.
He used to respect others, the colleagues, the teachers, the juniors. We had really enjoyed the company of Suman, Rajesh, Subbarao, and my seniors. Okay.
Yeah.
This is for Dr. Kapoor. Sir.
Which batch it is?
Same batch.
To us. No, he was junior to us.
Junior to us.
Oh,
He was junior to me also. Me, Rakesh Aggarwal.
actually, sir, that Google form has a admission year to fill.
Yeah,
It is based on that.
He was in Noida. Hi, Meeraji. How are you?
Miraji.
Hi, Meeraji. Shrikant, huh? Chetan Bhagat. Karishma Kapoor. Look at this.
Hi, Miraji. Nice to see you.
So you are muted.
We are together. He was doing his medicine MD, and we had a very nice time. Okay, helping each other.
Oh my God, you are our forever teacher.
Okay, thank you.
Bali. Yeah. Hello, Bali. How are you?
Hi, how are you? It's absolute pleasure, and you took me back memory lane, listening to all of you.
Oh my God, you look like Professor Wahi, yaar.
Yeah,
Yeah.
I was doing house job at that time. I was in cardiology for a short period of time. Absolute pleasure.
Oh, Meeraji, looking very smart.
I don't know, Sudhaya remembers me or not, but Sudhaya was a great teacher. Great teacher.
Yeah.
Oh, thank you.
I was always bedrock.
यार ये क्या है यार, LT1 प्रेजेंटेशन जैसा है, कोई तो बोलो.
Amar Singhal. Yeah, I remember Amar Singhal was always a busy. Whenever we used to enter the job to him, he used to say, "I'm very busy, yaar." मैं तो बहुत busy हूँ यार. He used to say every time I meet him. And I don't know where he is now. He's in Jaipur, but New Delhi. Okay. So मीरा जी क्या बात है? कैसे हैं आप?
First class, first class.
I know. We keep meeting in PGI Hyderabad. We have a separate WhatsApp group in called PGI Hyderabad, just started by Miraji, I think. You started it, no? And I'm part of it for some reason. Although I don't belong to Hyderabad, we belong to a different state called Andhra Pradesh. But thank
Politics,
you,
sir, politics.
Thank you, Miraji, for including me in the elite club of Hyderabad cardiologists. Nice to know about Amar Singhal. Never knew this. You worked in ICMR for a period of what?
There are some more people, Smith, Dr. S.C. Mishra.
Yeah, I see Mishra.
Sir,
S.C. Mishra, he
you'll
should
have
be
to-
traced.
Yeah. So give me names, give me numbers.
Sharad Chandra Mishra.
Sharad Chandra Mishra. He was from UP, Lucknow, I suppose. Or
He was from
Kanpur.
Indore, in Bhopal actually. His parents are from Bhopal. You know, in 1984 October, we had the gas tragedy, Bhopal gas tragedy. He was thinking of going back to Bhopal because his parents were there. But luckily, both
No,
his
but in
parents survived.
late, I think in 1991, he was with me in Saudi Arabia. I was there working as
19?
consultant in
Okay,
Saudi
that is
Arabia.
after PG, no, after MDM.
Long time after, I think
I'm
5,
talking about
6 years.
1984. I'm sorry.
Yeah,
That
after
time when
6,
we had just
in
exams were
89, 90, he was there with me in Saudi Arabia.
Yeah. He met me sometime in 2002 or something like that in Delhi. He was telling me he was blessed with three sons, I think. He was married. He was also married that time.
Yeah, he was married.
Both of us were married. We had children. I think even Rajesh Agrawal also was married. He had a child too. He, his wife, and we will have neighbors actually. Just the other room by the side of Karen Rock. And Dr. Sudhaya also was there with us. So we were all together. We were all hostel mates also.
I was in doctor's hostel.
Oh, you were?
Doctors.
But
Whole
somehow,
doctor's hostel.
I see. You did your MD also from PGI?
No. I came MBBS and MD from Medical College Trivandrum, Kerala.
Trivandrum.
Trivandrum, Kerala.
I see. I thought you were from Kottayam. No.
I am basically working in Kottayam, settled in Kottayam.
But
graduate and postgraduate from Medical College Trivandrum.
Like Girija. Dr. Girija also?
Girija, Suresh Kumar.
Suresh also.
Just senior to me. MBBS, MD and DM.
Okay. So, very nice. Oh, I met you once in 2002 when I came for a Kerala conference,
Yeah.
At that time, you had organized the conference, I think.
Yeah, that's right.
That's very nice. It is a very great conference, which I can never forget because I visited the whole of Kerala at that time. And
Dr. Manjuran organized. Professor Manjuran organized.
Manjuran.
He was the organizing secretary.
I think you were also one of the partners.
Yeah, I was there. We were active
I
in
met you there.
It was a teamwork.
Yeah, it was really great.
Yeah, that's true. That is the last time I met Sudhaya Kumar sir.
Yeah, that's right.
And I'm seeing Suman Sharma after PGI. This is the first time I'm looking at her.
Me too.
Same here also.
Yeah.
I could have invited you to Shimla, but so many landslides.
Oh, how is Himachal Pradesh? Oh my God.
Very bad. It's in very bad shape. Very bad.
Oh, so sad.
At times you get sleepless nights. Yeah, very bad.
I enjoyed the company of Meeraji because of multiple reasons. One nice person, friendship, academics, but more important, both of us, the height was the most acceptable thing for me. I was the chotu at that time. Till Meeraji joined.
I
I was
also
very comfortable when Meeraji joined. Okay. Am I right, Meeraji?
Yes.
Because I was called as chotu, chotu, chotu. Okay. Then I was really relieved, or just to get the company of Meeraji to that. And in Kerala, I formed a Chotus association. Where I am the president of this thing, where all are very tall, very hefty, all those people.
Yeah.
Okay, fine.
You know, in Telugu, we have a proverb. The short ones are the bright ones.
Not like that.
Puttovallu, Guttivallu. Miraji knows that.
Yeah.
I accept that, but they are very shrewd also.
Yeah. But not like you. You are
No,
super
that's-
shrewd. Above.
Shrewd in
When
the
Sudhaya
sense,
Kumar sir, when
and
Sudhaya
not-
Kumar sir was
yeah.
there, that is the time the new eco machine came,
Yeah.
and he's the go-to person for anything regarding 2D eco those days.
That's right.
I
Yeah,
remember
Even the
that.
senior faculty were learning actually on that.
I remember that. Fortunately, we had the fortune of having one of the early echo machines installed in Kottayam Medical College where I was working in Trivandrum. And when we joined the PGI, it was only MOD echocardiogram.
Yeah,
It was
it was
difficult, but
only-
for me it was
Yeah,
easy because we are doing that. And we had a few publications on endomycal fibrosis at that time from Kerala with the 2D echo, which was well recognized also.
Dr.
So
Vijay
I was
Raghavan.
not Vijay Raghavan and Manjuran, Professor George Jacob.
Okay.
Kottayam and Trivandrum had a lot of publications, presentations about endomycal fibrosis, predominantly the right ventricle. So I had some exposure. So there, when I came, the new machine came. So I had a little bit of experience. That is all.
Good. That takes you a lot.
You taught us all everything about it.
And you are very clinically.
You and later on, KK Kapoor and Sudhaya Kumar, these two were responsible for training many people during that time for their DM examinations.
Especially echo.
Extra classes they used to take us.
You want to
Take
add
for us,
something?
and then
I would like to add, not for my credit. I used to write down notes in 10 notebooks, 100, 200 pages notebooks. I had 18 notebooks, which was transferred to next batch. It went like that. And I'm not joking.
Great.
It went like that because it is useful for the examination because everything is there. In one day, you can finish the whole thing. So
Good.
that is one thing
Something
which is.
similar happened to me also. This is during MBBS. I used to make elaborate notes during my SC Medical College in Tirupati. So my brother, who was 10 years junior to me, he brought me home those notes. He said, Annaya, my brother, I have your notes with me. I said, how did you get hold of my notes? They were all passing on my notes from batch to batch till his batch arrived. So but that we did in MBBS. Why did you do it in DMR? I mean, you are supposed you did it in MBBS or what?
DM. I used to write notes from the school age, MBBS, MD, DM.
DM, we never had the time to. Okay.
Many people used to write Khatri's notes.
My own notes. It is not Khatri's notes.
I know.
I go through the books. I can't read the books again before the exam. So I write the important points.
I remember. Yeah, I still have them.
For my clinical
I never
practice.
gave those notes to anybody.
Khatri had fixed questions and answers, limited.
He used to fish out an ECG from his pocket and he used to ask, what is this?
But I think it is a great thing from Dr. Khatri because that's what our aim is, to pass the DM exam. Am I right?
Yeah.
DM exam. For DM exam-oriented questions are important. Okay, Professor Khatri gives the exercises just like these things, and that will be put into examination. So it will be easy for us. So that's a great thing about him. I think I'll talk about my consultants or teachers. Professor Wahi, great administrator, great clinician, and all the things. I will talk only the positive things because I always do that. Second, Professor Sapru, pediatrics. You listen to him. You start the transfusion of great pathways. starting from the history of this thing, and just like a novel, he goes like that. He's not bothered whether we are following that or not, whether we are doing.
Arrhythmia,
Never
especially
scolds us.
arrhythmia, was
Never
very
scolds
different.
us. Then comes Professor Khatri, his own style, great practical experience or whatever is needed for our examination. The same question we ask again, the same mistake we make again. That's how usually what happens. I'm not joking. So he's asking the same question, but we make the same mistakes. Okay, then Saprasab. Saprasab is disciplined. He doesn't want the textbook. He wants the reference for, we say it is given in Broadwell. No, he wants the original article. So he asked me a question during my DM examination. There is the professor, Bhatia from Alumni Institute asked, how will you record the blood pressure in a patient with atrial fibrillation? Still, I continue to ask this question to my colleagues as well as the students. How will you record the blood pressure in a patient with atrial fibrillation? I said, I take multiple readings. How many? 3 readings. I take the average of 3. Systolic, diastolic, mean. These are the questions he asked. Then I knew that I'm in difficulty. Then Dr. Sapru tried to help me. Sudhaya, please tell me how you are doing it in the cath lab. At that time, you have to take the pressurizing of mitral stenosis patients. You tell me how you are recording it in the cath lab. Again, you are in problem. So internal examiner trying to help me. But I said, I don't know. Then Bhatia said, tomorrow when you come for the Viva, you have to answer that, find out. I tried my best. I didn't get this thing. No books say that at that time. At that time, instead of the Jack, all those things, it was what is called a clinical note, WHO notes come, small books come. That is, it was given. It's nothing. What he wanted to know was whether I have seen that, whether I have read that. That's all what he wanted to know. Nothing. There was nothing great. It is multiple readings and take an average of that. But he wanted the reference where it is given. That's what they wanted. That is about Dr. Khatri. And then comes I.S. Anand, that dynamic, jolly person coming. Once what happened was the catheter got broken in this thing when it was being done from the femoral puncture. It was Eldinger taking femoral puncture, and the catheter got broken in the aorta. And all of us were in difficulties, and Dr. I.S. Anand was called. He came, and 2 hours later, he came, and you know, the tall person with that coat, all those things. From the coat's pocket, he took out this thing and showed me. These things I can't really great.
No, you're forgetting about Professor Bidwai.
Yeah.
He was our, I mean,
Gem of a
I was
person,
his
right?
pet. And Miraji especially, he was a pet of Dr. Bidwai for some reason. He should tell me.
Pardon?
Bidwai was, yeah.
Bidwai?
It's a special bond between Miraji and Bidwai. I don't know why.
Even I don't know. I was kind of an adopted son.
Yeah.
I used to go to their house. And before his demise, he even came to me in my house, and came to even Maldives.
Oh, really? That's so, you're so close to him. And you worked in PGI for such a long time, no? You worked there for 10 years?
12 years I spent in PGI.
Including your MD and DM.
Yeah.
I see.
Any other anecdotes, Dr. Sudhaya Kumar, Dr. Suman Sharma?
Any other anecdotes?
Anecdotes?
Professor Khatri giving the Lidu, you will not quote that? Anything occasion he gives us Lidu. So talk everything positive about those people. He used to give us Lidu, and he invited us and gave us the evening dinner in his house. 2 occasions. Professor Bidwai
also had given us.
He had given.
He also had given.
Professor Wahi has given.
Wahi and Professor I.S. Anand. I.S. Anand and his wife.
That's right. Great, very nice couple.
Both
are very jolly type.
They're very nice job. They used to have a big house. And Bidwai, Dr. Bidwai came and inaugurated my hospital in 1995. And we took him around. He was our chief guest on that day. And our new hospital building. Miraji knows my hospital.
Yeah.
He used to come too. Even till the other day, he used to come. Of course, now he's become very busy with TAVI and all that. But Miraji was our consultant interventional cardiologist in SV Heart Care Center. That's a hospital that we have. I hope.
Miraji, Chandrasekhar was your batch for MD.
My Bali's batch, Bali,
Bali's
Chandrasekhar are together.
Chandrasekhar is the gastroenterologist in Chennai.
No, that is T.S. Chandrasekhar. We
T.S.
had
Chandrasekhar.
3 Chandrasekhars.
I am talking about T.S. Chandrasekhar.
He is a big man in Chennai now.
Chandra.
We had Minimus, TSC Longus. He's a neurologist.
That's good.
Chandrasekhar, neurologist. This one and like that, you know.
Minimus longest brevis, sir. Okay.
Brevis is become Y. Chandrasekhar. He is now editor of Jack Imaging, full-fledged editor. Bali's batchmate. He should be able to tell more, and their turn will come anyway.
Last class he had taken on cardiac MRI in our,
yes, I missed it. I wasn't in the city.
So there is a video for that, sir. It's available on our channel.
YouTube you can go.
The problems of collecting the. See, this is the time when Dr. Sudhaya Kumar, Suman Sharma, all of us, our imaging was cut films, 6 films per second. And the hemodynamic data is recorded on a photographic paper, which we are supposed to, develop it, dry it in the radiology department, then roll it into this thing, and then whole night calculate all those things. That was ancient methodology, but that's what we did. And Sudhaya Kumar used to help us always how to measure and do all these things.
Miraji, this was also the era when arterial puncture was done directly and a green wire was put in, and then the pigtail was put in on that green wire. So especially in children, many times the artery would disappear, femoral, and a line would be put in there. And we houses would be asked to keep a watch on those arterial pulse. And the surgeon would keep on coming and watching. And we would be starting on heparin 100 units per hour and just keep a watch whether the artery is coming back or not. So that was long before the sheets actually came along. So
the needle was terrible. It is a winged needle, full metal. We used to go through and through. Anterior wall puncture was not known then. At least during my time. Maybe by Bali, did you had a chance of doing anterior wall puncture then?
Yeah,
Maybe
during our time, we had that procedure. But that is when I joined DM. I'm talking of the time when Dr. Sudhaya and Suman and everybody was there. I would not to play that time. I'm talking about that time.
Selling a puncture through and through, and the lack of the distal pulse is not infrequent. and pray. The first thing we pray is the arterial pulse should be okay. Otherwise, second thing was we do congenital heart disease, we do the study and present it next day, and there will be a lot of lapses in that, and they ask us to do repeat procedure. That is the biggest insult for us. Or biggest what we call as not insult, the negative scoring.
Yeah.
And not infrequent. There is the data is incomplete or we can't answer their question. So the next thing, Professor Vahi says, oh, you repeat that. And we have to go to the patient, bystanders, plead with them and tell all the lies and then take him for repeat procedure.
That's true. And oh my God, that's terrible. Dr. Sapru used to put a balloon in the coronary and then almost, fall asleep. We used to wait, and it was the early days of angioplasty was really traumatic.
Traumatic to the patient or traumatic to the doctor?
Mental trauma to us.
And physical trauma to the patient.
Yeah.
I remember giving a lot of trouble to Dr. Subba Rao and Dr. Mishra as a house physician.
No.
Bed nahi hai Friday ko, how to create beds and all.
Yeah.
Dr. Subba Rao, you remember that?
I remember that. Yeah. Every time we had a problem creating beds for Dr. Vahi's OPD, which was on Friday. And exactly after he ends his OPD, we used to have a meeting. So we used to miss our lunch.
It's not only the beds, the problem of collecting the X-rays and then case reports and other things to be given, all those issues also. We had terrible time.
Yeah, yeah. But he was, I mean, he never used to accept no as answer, no? He was
Yes.
always,
I really enjoyed
No.
that because I learned a lot, not only cardiology, administration from him.
Fantastic.
Administration I learned because I came back. I was in administration of the medical education department. Benefited me a lot. How to time factor. He sees
Think,
that he will not waste our time also. We say that Dr. Miraji, you come and meet me at 2:15. He will be called at 2:15. It takes only 3 minutes or 5 minutes. That's it. It's a great thing. Administration, I learned a lot from him.
yeah.
And gentleman's memory. In
Oh,
spite
great.
of his good memory, he used to manage that small booklet with a sharp pencil. He used to make note.
To do
Very
it.
sharp pencil.
Yeah, as sharp as his mind.
Mm.
It's wonderful. I really remember.
Okay.
Where is Rajesh Agrawal and Rakesh Aggarwal? They didn't join today? Did they not?
Dr. Rajesh Agrawal is traveling in US, so he was not able to join. And
Rakesh is in Delhi?
yeah, but I could not contact him, sir. I don't have his contact number or anything.
Rakesh is in Ludhiana. Rakesh is in Ludhiana.
Rakesh in Ludhiana.
Oh, I see. It's written as Delhi, so I thought.
He was earlier in CMC, but I don't know where he is now. But he's in Ludhiana.
Another thing I would like to share is I did my MD first year in PGI also. I don't think many of you are aware of that. And Rajesh and Rakesh, both of us, both of them were my colleagues at that time in 1978 to 79. So after that, I got MD in Tirupati and I went back because at that time it was 1+2. Again, I had to pay for the exam. So I was not sure whether I'll get the second year exam, second year slot now because there are 10 candidates and only 5 slots or something and 2 reserved and all that. So I went back to Tirupati. So between 1978 to 78, after my house surgery, I immediately joined Chandigarh, PGI, as a first year resident. And during that time, Rajesh, there used to be one Suman Sharma Rao, and there used to be a lot, this Kapoor also was my colleague at that time. KK Kapoor, and there used to be one nephrologist. He became a nephrologist. Kalra. I don't know whether you remember Kalra?
Kalra,
He became a nephrologist. Yeah.
O.P. Kalra.
He tried cardiology. He couldn't become. Along with my batch, they all tried. Kapoor and Kalra also tried. But luckily, both the seats that were reserved went to the outsiders, non-PGI people, like me and Ms. Mishra at that point in 1983 January. So I knew Rakesh and Rajesh even before. That's what I was trying to tell.
Maybe, sir, if you can find their contact details.
Okay. Sir.
Yeah, somebody should try,
Ludhiana, let me try Dr. Wander if you can.
Why?
Sir, you're muted, sir. Dr. Bali, you're muted, sir.
Yeah, I'll give you the detail of Dr. Rakesh Agrawal. Should not be a problem. I'll forward it to you.
Sir. And now, sir, about your magazine also. Again muted.
Rajesh worked for many years in Patna, I think.
Alumni PJ.
If I remember, he worked for many years in Patna Medical College.
Miraji unnadu.
Rajesh Agrawal.
Rajesh Agrawal. Rakesh Aggarwal. Again off.
Boss?
Yeah, about PJ Hyderabad. Miraji Rao. What was the idea? How did you start it? It's really a great thing.
We will talk about it later. Now we are talking about your batches. So let us focus on this.
Okay.
Rajesh Agrawal worked for many years in Patna Medical College. That's what I remember.
No, he was in charge of the Indira Gandhi Institute of Cardiology.
Yeah, he was in Indira Gandhi Institute in Patna.
He was the director actually. But that was state managed. It was not funded by center, no?
Then Dr. Clare also during this period only, right?
Senior.
In fact, Clare is senior
Rajesh.
to
Senior to us.
Rajesh and Claire were same batch.
No, no, no.
No.
Claire is senior to us.
Rajesh
Claire,
and Sudhaya,
Ginta
Sudhaya
and
Kumar.
all.
Yeah.
Claire.
Sudhaya and Rajesh.
No, Sudhaya, Rajesh and Suman.
Oh,
Same batch.
all the three
82
of them.
January batch.
Okay.
Suresh,
Claire.
Girija,
Oh,
Claire
Claire
and Mohanlal.
Girija.
And
Claire,
Mohanlal.
Mohanlal.
Mohanlal. Senior to that was Jagan Mohan. Senior to that was Koshipan.
They
Koshi,
used to
Rama.
Taragan also.
Taragan was senior
Jagan,
to that
Jagan,
1
yeah.
year. 2 batches senior to Jagan Mohan Taragan.
But he was
Jagan
there
Junior.
when we joined DM Cardiology. He was probably in the faculty or pool officer or something. Yes, he was supposed.
When
He
you
was in
joined,
That
Chitra
was
Institute.
83,
He
82
retired from there.
December, 83 January.
he was in. He
And
worked
which
in
batch was Virenna?
Virenna belongs to Aggarwal's batch? Ah,
No,
no,
Virenna is
Rakesh,
just
Rakesh
senior.
Aggarwal's. That is junior to me. Virenna
Yeah.
Gonda.
They are my immediate seniors. I
Yeah.
did the cath lab posting with him. He lives in Gulbarga. He must be in the group.
He is not.
Smith, is
I
he in the
only-
group?
Which group?
Which one, sir? I could not.
Which group?
That G. Virenna.
No, but someone from Gulbarga is in the group, was recently added to the group.
Yeah, I only sent the number.
Then he's
I
in the
will
group.
send it again.
Yes.
He is my senior.
Yeah,
Can I
Virenna
ask?
Rakesh Aggarwal, I think.
One question, that glamour young person, Dr. Smith, to which batch do you belong?
My entry year was 2010 and exit was 2012.
2000.
you're very young.
Very
fine. Okay, fine. Look a misfit for the other in this group. We are a misfit for you. Okay. 2010 only.
Yeah.
That means 30 years, almost 30 years junior to us. Okay, fine. Great. Nice. Okay, very nice time, nice evening.
No, he's
nice of him
he's
for
the
arranging.
he's the force behind bringing out all these things, catching everybody, bringing them names, trying to figure out who
Find out.
belongs
We
to which
had
batch.
forgotten, but he was remembering when we joined. I had actually forgotten when I joined and all. I said, I'm not sure. I have to look at the certificate.
So again, sir, the same thing we have. We have a master class every 4th Friday, 8 p.m. to 9:30 p.m. That is fixed. Every 4th Friday we have. And it is presented by us, for us, and attended by only us.
Fantastic.
And this event happens in January and August. So it's easier to remember 26th of January and 15th of August. So that month, again, the 4th of Friday, we'll have same. So next would be Dr. Subba Rao's batch, and we'll start finding out, digging out. Yeah. And I think Dr. Bali is also there for the next batch.
Good. Okay.
So Bali
How many batches? How many batches are you combining?
It all depends, sir. We wish to have 4 to 6 members, so that everyone gets enough space, and 4 is okay, 6 is best. More than 6, it gets crowded. So actually, all the previous events we had around 10 minutes or say 3 to 5 minutes of video. We had their family members, their other journey and other achievements. So that is how it happens, and then we have all these discussion.
This is more interesting. Okay, we get time to interact.
Yeah, we have to come to Delhi. Delhi, say Chandigarh. There is a flight from Hyderabad to Chandigarh, I suppose. Time? Viraji?
There is, yes.
Okay. Then same time.
And
plan it in January.
In the same tune, sir, I'm also planning that we'll have a PGI get together at Raipur for 1.5 days. So that would be in another year, sir, because I have to really work for that. And that would be like, we'll be again discussing our cases, presenting to us, would be like a morning class session only. So let me see if how that turns out. Sir.
Thank you, Dr. Smit.
Right.
Really very nice of you. Yeah, basically, where are you from?
Sir, I am from Raipur. And there is a direct flight from Hyderabad to Raipur also.
No, you are nearer to us than to Raipur, you know, Rajahmundry.
So quite a lot of patients are being referred by Dr. Meeraji to me, his patient.
Really?
Yeah.
Yes.
Oh, good. That's right. So you are from Chhattisgarh.
I'm from Chhattisgarh.
Okay.
Yeah, you're not a film star.
See, actually, there is a Professor Srinivas Reddy in Chandigarh, PGI. I requested him actually to give us the list of people, you know, the batches, confusion.
Yes.
Who belongs to which batch and all. I requested him, but somehow I could not get a response.
Sir, I tried that while I was at PGI. So records are lost before 2000. Once they shifted from the old PGI block to the ACC. Those registers and those records were not actually taken care of, and they were not shifted probably. So I tried to locate them, and you know, at the time I was trying to start a email group, and now it's WhatsApp has made it very easy. So easier way is that you can, you know, that Google sheet which we have made.
I know.
You can rectify in that as per the admission year. So if you are confused, admission year for their MD, but it's for their DM that everyone has to fill in.
So in this group, MD medicine from PGI is not to be included, right? It's only DM.
We have not. Only DM from PGI.
Yeah, that should be the thing. Yeah. My batch, I told you, Man Singh and Chutani. Chutani I could catch, but Man Singh is lost. Nobody could get. And Bali, Chandrasekhar are immediate junior batch. So Bali would be knowing many names. And now for the senior batches, now this Subbarao, Sudhaya Kumar sir and all should be able to tell us which batch what, you know, like.
Senior batch, there's a Koshi, everything, I think they were given the recognition previously. I attended that, I just saw that.
No, they attended, but exact batches,
no,
you know.
I think it is already there. Yeah.
Man Singh, I think he is from Nepal, no?
Yes.
Very handsome child. And he
Is
was a
Nepal
officer for PL Wahi. You know?
Yeah, he went to US.
Okay.
He still is in US, but not able to trace. Chutani also is in US. Both of them are my batchmates. He's also...
Chutani was a sponsored person. He was from Kota, Rajasthan.
But whatever it is, he's my batch.
Okay.
Okay, he's my batch. And he did DM from there.
I remember that, yeah.
So I'm in touch with him.
And there used to be one captain also, remember? One captain.
He worked in, that is junior batch again. They were from army. He was in escorts also.
Yeah. What's his name?
Colonel. He's a colonel.
Okay.
Those are junior batches. They are
Colonel C.P. Roy. Colonel C.P. Roy.
That's right. Colonel Roy.
That's right.
Colonel C.P. Roy.
Roy.
And there was
I just met him day before yesterday in one of the conferences.
K.S. Rao used to be there. Another. Then Bengali doctor, non-invasive. He started practicing in Apollo. I'll get the names, you know. Suddenly I'm unable to get the names.
Dr. Pradyut Ghosh.
Pradyut Ghosh. PK Ghosh.
He's in the group, sir. Dr. Ghosh, I think, is in the group.
Yeah, Pradyut Ghosh.
Yeah.
He's PK Ghosh. Like that, I think like this only we should be able to get the names now. Now that the records are lost.
And ours is a registered body, sir. Even we have thought of, giving a full-fledged membership also, kind of, so that everyone gets involved. And we are NMC secure also that way.
NMC?
NMC.
NMC.
Yeah, we are not supposed to write generic drugs now.
Yeah. So for this conferences or whatever conference we'll be having for PGI, we can have our members come in, officiated members to come in and attend it like that. So that those things are being worked on. Once we finalize that, we have a written constitution that also I have shared multiple times in the group. Just go through that, sir. Suggest if any amendments are needed. We need to have one conference every year to remain registered body. We have a PAN card. We have registered with the Registrar Society. So everything is done. That's a very legal thing and very open. It's for us.
It's good.
And thirdly, like Dr. Bali sir is taking that, we'll be starting a quarterly journal like thing. Somebody is trying to take over registry. So all those things for us, those things can be made possible.
That's great.
That's the idea.
Fantastic.
Over to you, sir. My
I'm taking leave because I have something. I think many people have left. Dr.
Yeah.
Bali, what are you doing, Bali? You are now.
I am Chairman Cardiac Sciences, Paras Group of Hospitals.
Which
And
in Delhi?
Paras Group of in Chandigarh, Paras Group of Hospital, with all the hospitals.
Paras.
But I'm located at Panchkula. And I do all those things which I used to do for the last 25 years.
Oh, great, great. I know.
Other than making riddles, I do everything.
Because we are lazy fellows, we are non-invasive cardiologists.
You're doing a wonderful job, Uncle. Absolutely fantastic.
Thank you, thank you. I don't know who is saying that, but I'm grateful to you. I hope. Just to make you, because we are not that busy anyway. So I'm not practicing in the evening. I'm practicing only in the mornings. Miraji knows everything. He's come to he came to hospital so many times, and he is impressed with our garden, terrace garden.
Oh, great.
Ali is the big name in intervention cardiology.
I know. Yeah. I know he's been publishing all those data and PG, that WhatsApp group also. And
you should come to Chandigarh one of these days, yeah.
Classification of.
Yeah. That's what. Maybe I'll come in this January or next meeting anyway. I have to come. So, yeah, certainly. I'll come and meet you.
Bali?
Yes.
You had a classification of coronary anomalies, right?
Yes, I made a Bali's girdle, which is, more stronger than the albatross.
Oh, really? That's great.
Are the anaconda.
Anaconda.
Oh, great. That's fantastic.
We should publish in our the quarterly journal and then share the joy and also the knowledge.
Yeah, I think we should start going on to this journal in the next 1 or 2 weeks. And I'll be inviting, articles, case reports and review articles, and everybody can contribute. So let's have it going.
Oh, yeah.
Smit is the, driving force behind this group. And I always fall short of praising his efforts and his commitment and his, how he has been able to achieve so much about this group and keep it, very, very harmonious.
Smith is phenomenal. He's phenomenal. I mean, what he does to the he is different, and what he is doing in his own state, being in the government sector, there's so many things, laurels,
Well, it's all over to PGI, sir. Nothing. The training and the discipline, what we have been discussing so far.
Here I would like to tell something. PGI, the Dr. Wahi and Dr. I.C. Pathak, they were the directors then. What they said is, we will teach you how to think aloud. Rest of the cardiology, you go and read the books. That's all they said. I think it's a phenomenal thing, you know.
Yeah.
Teaching aloud is a phenomenal thing. That's how guys like Smit and Bali are coming out.
Yeah. I think I owe everything to PGI. There is absolutely no doubt about it. Everything. What
me,
our little has been able to do is because of PGI.
You know, having come
It makes you start believing that you belong there, belong to the highest level in the country and maybe in the world. So that is what confidence PGI gives you, and interacting with some of the top minds of the country gives you that thinking power.
Wonderful.
Great institute.
Yes.
You can take a person out of PGI, but you can't take a PGI out of a person. So that will stay with you.
That's right.
See, that thing, even at a senior level, the down south, there is a lot of hierarchy and all. Whereas PGI guys, we don't mind pulling the trolley of a patient, helping in this thing. So the work here, the technicians, they don't want to even carry the ECG machine to the bedside. So work, I think.
Work ethic.
Yeah.
Yeah, that is the confidence I had. Immediately after DM, I started my practice because everybody told me that to join government service, to join one institute. But I had that much of confidence because I also did my first year in MD. As a first year MD, you know how many troubles you have to face. I don't know, Miraji, you belong to 1+2 batch or you were 3A batch?
I belong to 1+2.
Oh, so you went to 2 hurdles to get to MD. That was too much for me. When I got my MD in Tirupati, I went back. Same thing happened when I joined Chipal also. What is as MBBS? So it's very nice interacting. Okay, we don't have a cath lab, but there are about 5 cath labs in Rajahmundry right now, and there are so many cardiologists now. I was the first cardiologist here, and now there are 20.
One of my colleague from PGI joined Rajahmundry, sir. Anupam Jaina. Anupam Jaina.
Anupam, yeah. But he left. Oh.
He left. He left for Seoul. He went
Anupam is at Westmid. Okay.
Yeah.
I think he went to. Where did he go? He went back to.
He is now practicing at Bhubaneswar, Kim's Bhubaneswar.
Kim's Bhubaneswar. Okay.
Yeah. So he comes here at Raipur every 2 months to do EP cases with.
Oh, okay. Yeah, he was very active months. He was also, one of the Chotu batch, as Sudhaya Kumar says.
Technicians, Charan Singh and
Sanjay.
Balwant.
Sharma ji hai.
JK Sharma.
They used to guide us.
They were our technicians. Are they?
No, they used to be our teachers also.
I know.
Teachers also.
Hello? Anybody knows? Bali?
Yes, please.
वो लोग अभी जिंदा है लोग any idea?
I think one of the junior technician, Mr. Baldev Singh, we lost him, but rest everybody is fine and doing great. JK Sharma ji is fine, Charan Singh is fine, Kol Saab is fine.
Oh, great.
There was one Mr. Gupta in our ECG lab, he's fine. Vinay Gupta. And who else was there at that time?
Lanky
I think
man.
Yes, please.
Tall, lanky person. Gupta.
Yes. Vinay Gupta. Yes, he was in the ECG lab.
He was there till 2012, sir. He retired, I think, close to 2012. He was, I think, store in charge or something. Cath lab store in charge by
Yes, he started his career as ECG in charge, ECG lab in charge. Quite chap. So, and Charan Singh ji used to say कि आपसे नहीं होता है pacemaker तो मैं डाल देता हूँ. If you are not able to enter the pulmonary artery, should I scrub? That was his.
Yeah, practically he used to guide us.
Yeah, patient, to permit me or pardon me for saying so, the miracle, JK Sharma had a aortic valve replacement then.
Oh.
It means, look at the miracle of cardiac surgery in a person's life.
No, but I don't know he had a aortic valve replacement. I didn't know that.
I know.
Okay.
So
I know so many things we don't know.
So in fact,
then there was one Mr. PP Singh in the stores, if you remember, who had about 6 leads. And, there was small sinus at the pacemaker lead insertion site, and there will be some decay, some discharge from there. He will take some antibiotic, it will go up. But he had an X-ray where there were 6 leads. So he was another great person in PGA in those days, Mr. PP Singh.
Sudhaya Kumar sir, always I'll ask questions. What is the longest survival you have seen in a valve replacement without?
Okay. You have put me in trouble because it's not easy for me. Longest survival, because I don't have such a follow-up. So I've seen large number of patients. I will put it the other way. So many patients who have been advised CABG for severe triple vessel disease. I've seen large number surviving on medical management for more than 15, 20 years.
Oh, yeah.
Yeah. So that's it. But regarding the valve replacement, I've seen people beyond 20 years. The steroids going beyond 20 years, and obviously the newer ones. Definitely longest I can't say. Longest I can't say. Definitely more than 20 years, 25 years I have seen. But I have not kept a record or a biodata or records of these patients. So I will not be able to say that. If you had asked me some academic question, I would have answered.
These are fun questions.
Probably.
This Sharma, if he's still alive and doing well as per Dr. Bali, that means it is at least 35 years plus. He did not have a redo surgery. That I am very sure of.
I'm not very sure because I met him so many times, but he never mentioned about aortic valve replacement or something like that. But let me check it up. Maybe tomorrow or day after I'll ring him up and find out about this aortic valve and see. But I also have seen about 20 years follow-up. Maybe the longest I've seen is about 20 years of mechanical valves.
I've seen more than 35 years. I mean, one patient who was operated upon in Madras, Chennai, she keeps coming to me even now. She was operated by Dr. Cherian in Vijay Hospital when he was in Vijay Hospital. I've seen that patient surviving for more than 35 years now.
And
what Dr. Sudhaya Kumar mentioned about triple vessel surviving long, when I got OPD of Dr. Khatri, and there were many patients who had gone to Madras and got their angiography done with documented triple vessel disease and had been managed on medical treatment, and they were doing wonderfully well. There were about at least 100 patients such, because angiography in those days probably was done in Madras only. So all of them proven triple vessel disease on medical treatment, doing fine, maybe 10 years, 15 years after their angiography. That much I have seen. So that Saturday OPD was full of such patients who would just come for regular follow-up, 3 monthly repeat of medicine and carry on. So that is okay.
And
medical management.
Professor Bidwai had left bundle branch block.
He had left anti-hemi block, that I know.
Complete.
LBB. Well, how did he had a stroke, huh? He died early.
Yeah, he had a intracerebral hemorrhage.
Oh, he was hypertensive too.
Yeah, he was hypertensive. He was quite severely hypertensive.
But he was so smiling, and from his personality, you can't guess that he's having hypertension. So that means the hypertension is totally some secondary hypertension or something.
Bali?
Yes, please.
Did Dr. Khatri have pulmonary embolism?
Yeah.
Yeah. He had pulmonary embolism.
Yeah, he had a chronic thromboembolic pulmonary hypertension, and he was on anticoagulation, and he was in heart failure. And finally, on that day, I vividly remember that day because I done an angiography on a complex congenital heart disease on one of his patients on that day, and spoke to him at 5 p.m. And on that evening, we lost him. So he probably had a fresh PT. So that. Yeah, no, it was a chronic thromboembolic pulmonary hypertension. Maybe some more thing may have gone up, and that did the balance. But he had about chronic thromboembolic pulmonary hypertension for about 3-4 years prior to the final event.
So sad.
If a person hasn't been to Hammersmith, he's not a cardiologist. He used to say.
Yes, absolutely.
Great guy.
Great guy. Absolutely committed to cardiology, no doubt about it. Absolutely committed to medical, MD medicine, cardiology teaching. Great. Was it a Thursday OPD? A Thursday bedside he had? Which was the famous bedside he used to take.
Great. And one of the Anil Bhalla was our medicine batchmate. He became, used to say Khatriology. He made the theology.
Yeah. Anil is in Gangaram.
I know. He's Padma Shri and all.
Yes, he's Padma Shri. Okay. And I think he's one of the board on the board of directors now, probably.
Yeah. JP Singh is a. Oh, JP Singh is batch.
JP Singh is chairman cardiology there in Gangaram.
Sani.
Yeah, Sani.
Oh, yeah. He is supposed to be the greatest cardiologist on the world. That's what the social media says.
Okay.
Yes. Yes.
Our group, PGI group. That's it.
I'm proud of him also.
No, I think most of the PGIs are doing very well all over the country.
Yeah.
Even in other branches, not only in cardiology, we have a local PGI group also.
No, you see gastroenterology, Dr. Reddy, you know.
Nageshwar Reddy. He was my batch. Yeah. And Dr. Ravi Raju in Visakhapatnam. Somaraju Garu, of course, a senior. He is now AIG. Yeah.
He's also joined AIG now.
Yeah. He had to leave Care Hospital. I don't know the politics. I think Miraji would know.
No, not politics. Because I think he's sold his share probably at a very, very lucrative price. And then he exited rather than he didn't have to leave. That's what I heard. But Miraji would know better. He's a authority on such things.
He's with AIG now. Along with other countries. They're doing well. So JP Singh is your batch, right, Bali?
No, JPC is senior. He's 6 months senior to me. Medicine. He did his DM with Jagmohan. JP Singh and Bimit Jain. Bimit Jain and JP Singh were batchmate along with Dr. Jagmohan. And I think there was one fourth person. Who was the fourth person?
Sharat Chandra was there.
Sharat Chandra was junior to me. Sharat Chandra and Chandrasekhar. Chandrasekhar was
but he was actually Miraji's batch, I think, or senior to Miraji. NMD. During MD, he was senior.
JP Singh is MD batch. JP Singh, Anil Bhalla, and I, Ajay.
Sanjay Kalra.
Yes. We are
Miraji, what about Dr. K. Sharat Chandra? Where is he now?
Hyderabad.
He's in Hyderabad.
Oh. Sorry, I have an another program at 9:30, which I think. Shall I take leave?
Sir, we'll all.
It's a great pleasure. Great pleasure.
Yeah,
really
I think we had wonderful meeting.
Yeah, wonderful meeting.
It is really
good. Nostalgia about PGA of 82 and 83. Thank you, Dr. Smith, for giving me this opportunity. Suman, and Raji and Subbaravu, then Meeraji, Professor Bali. I'm not that familiar. Thank you so much for giving me this
Thanks a
golden
lot.
opportunity. Good night.
Nice meeting you.
Please,
Dr.
please
Sudhaya.
do join, sir, on
Yeah.
next
Right.
Fine.
Perfect. Yes. Thank you, sir.
Okay.
Good night.
Fine.
Thank
Okay,
you
good
so
night.
much. Okay, bye.
Bye, everybody.
Bye.